This, as we said, it's the first joint symposium between the British Society of Antimicrobial Chemotherapy called BSAC and EWMA. And we are looking forward to have actually collaboration. We are very proud that we can collaborate with you because BSAC is a very well-known society. It's well-known worldwide, and I think we will have a possibility to have a very good jointship here. The objective of this meeting is we have to enlighten on the innovation of best practice on prevention, diagnosis, and treatment of wound infection. We need also, in the long run, to focus on education about the challenges in the antibiotic resistance, and we'll come back to that. And we need to inspire and prepare and get people interested in this. The major barrier for wound healing is infection. Bacteria infection, necrotic tissue, and these two things probably is going to be very much the same. The curious thing is, it's not the best to have a total sterile wound. It has been shown by basic scientists that if you have a total sterile wound, it's not healing as fast as if you have a small amount of bacteria. Not as the big amount. The small amount is 10 to the first to 10 to the second of 1 gram of tissue. And actually, at this place, you have a better healing than a total sterile wound. So in some way, it may be we should not go total sterile. But if you have a major amount of bacteria, 10 to the 5th to 10 to the 8th, then suddenly you'll see pus. So that is the major challenges for the wound area. If you're looking at the balance between microbiology factors on one side and host defense mechanism, that is the result giving infection. There's a lot of things I won't go in detail with this. The only one I will focus a little on is the resistant development in the world, because resistance is one of the major challenges in the world today. This is a little older one, but still I think it's very interesting to see. If you're looking here, it's not very nice to be read. It could have been communistic, but actually it's not communistic this way, because it says that up to 50% of MRSA is resistant. And then the reason I actually is showing this is because I'm coming from this country, together with this small one. We still have lesser than 1% of our MRSA, which is resistant, MRSA actually. So the key point for us, we are fighting with it now because MRSA is increasing also in Denmark, but we have the fortune that we still can isolate the patient every time. If you have, in where we are sitting today, in England, 50% of has MRSA, of all the wound, for instance, then you can't isolate the patient anymore. But in this area, we have been very restrictive with our antibiotics during the years, and for this reason, actually, we still have the low MRSA incident. There has been, related to resistant EU initiatives, because we know that in appropriate use of antimicrobials, especially antibiotic, has created resistance. And we know that even both for the inpatient and the outpatient area, we have up to 50% of the use of antibiotic is inappropriate. And we need to do something about that. For this reason, EU took it up, and in 2012 in Copenhagen, actually they have a major meeting about these things. Why is then EWMA interested to go into this work? We are a general broad wound society. Because the misuse, as I said already, and we are an interest organization in wounds, dealing with wound care, and we have to go into this because this is one of the major problems we have. I can say today in Denmark, for instance, at least yesterday there was an article again, the major issue in Denmark is how is MRSA developing? Is it coming from agriculture? We have a big debate in Denmark about whether it's pig infected, which is spreading to human. And there's a lot of discussion between the agriculture people and us about this. But that's really one of the key points. EWMA advocate prudent and appropriate use of antimicrobial agents should be in the future the way we do it. And we encourage development and treatment of recommendation. Everybody talk about recommendation, but unfortunately they are not implemented, all of them. And that is the key point. We need to have good implementation of antibiotics. EWMA has done something beforehand. That was before we actually was in contact with BSAC. We have made an antimicrobial non-healing wound document. And if you don't know it, I will shortly describe it a little. Actually, it's on 90 pages, so it probably will never be read by all of you. And we also have a lot of conference presentation as we're doing today. And then now we are focusing on this antimicrobial stewardship program, which will be launched today. This is the first one from our document. I'll shortly go through how it was built up. It was a group with myself as chair which started it. The objective was to update and focus on how are the evidence for what we are using about antimicrobial. And then show uncovered controversies, and then offer perspective for future work. That was what we have to as objective. The document structure is made like a healthcare assessment system, and it's only to make a new way. I have seen so many recommendations and guidelines for how much and how we actually use antimicrobial. I think we have seen 200 the last few years that way. So we should not do a new document for that. So we actually have some chapters, I'll come back to about 8 chapters. And the first section are where are we today and how is the assessment of the current literature of which evidence and which level of evidence do we have of the single procedures. And the second section is focusing on controversies. And I'll give you a few examples only. This is the chapter, the subdivision, introduction, methodology, terminology, the role of bioburden in wound, treatment of wounds, patient's perspective, organization, economy, and future perspective. And it's an ATA way to look at this problem. And then, for instance, from chapter C, the bioburden, I show you some of the controversies we discuss. And we go into the literature on the controversies and say, which is the evidence for what we are looking at? And one of the first questions was, do bacteria impair wound healing in a non-infected wound? As I said, normally don't do it. But there is a big discussion about that. The second thing, should microbial organism always be eliminated from the wound? Is it a must that we have to clean it totally? Everybody would say yes, but is that correct? Then, some years ago, about 10, 15 years ago, we got a new definition, critical colonization. As a clinician, I have a very big problem actually to say whether a chronic wound, especially a diabetic wound, is infected. But now, in the middle of everything, they actually put a new definition, critical colonization. When did that come? It came exactly the same time as the silver product came. Because what is the main indication for silver? Critical colonization. So I think it was made that way, but I don't know what critical colonization in a wound is. If you're standing in an outpatient clinic and you have 20 patients in front of you, I cannot say whether it's critically colonized or not. I can say hopefully it's infected and we have to give antibiotic. But this one has been used, and a lot of people has been very famous on that, but we don't know from my point of view what we should use it for in the clinic. Another thing, biofilm itself, does it really influence wound healing? Biofilm up in our area, everybody talking biofilm. And you will see it also in this meeting. But is it really important for the wound healing? We discussed that. And finally, as an example, antimicrobial agent. Is there any of them who is not developing resistance? I would say I remember one, honey. I haven't seen any resistance for honey yet, but it may be one of the few. But it's only to take controversies. Everybody knows everything about controversy, but nobody knows really the background for it. So if you want to have this, you can download it directly from the Journal of Wound Care or also from the homepage of EWMA. You can directly print it by yourself if you want to have that. And there is a long version, and there is a very short version. I think it's easier to read. It came last year, actually. So finally, in my talk, I'll say EWMA is starting a new stewardship program, antimicrobial stewardship program, together with BSAC. It's aiming, as I said before, reduce inappropriate use of antimicrobials. Also, develop and publish clinical treatment recommendation. We are discussing how to do it because, as I said, we don't want to be number 2004 in a long row like others. We have to do it the way. And the second thing is we need to have it implemented. I have seen so many recommendations and nobody used them. It's dependent on where it is. We need to have it more generally in EU or something like that. And then we have educational curriculum and events. We have decided to do some symposia in future meetings also. We have regional courses also, and we need to have the collaboration we have done for several years with EU and get it into the Commission and so on, so they have the focus on it. We have, until now, some sponsors which are supporting us very nicely, and we want to have more if possible, but we will thank the people who already are there. Thank you very much.